Let's Move channel. Today we're going to talk about diastasis recti in pregnancy. What is it? And can we do something about it while we're pregnant? So diastasis recti abdominis, or DRA, is the separation of the two muscle bellies of the rectus abdominis muscle. This happens due to an impairment of linea alba, the connective tissue between these two muscle bellies. Diastasis recti usually develops in the third trimester as the growing uterus pushes the two muscle bellies of the rectus abdominis muscles to the sides and causes linea alba in the middle to stretch. Linea alba is highly elastic and in many cases retracts back when pregnancy is over. But sometimes, when this tissue is overstretched, it loses its elasticity, so the gap between the rectus abdominis muscle bellies does not close as much as it should after pregnancy. Most women don't notice diastasis recti until in the postpartum period, but during pregnancy, you may notice it when you see coning or doming of the abdominal wall, when you, for example, attempt to raise yourself up from a lying position. Coning or doming is like a ridge down the midline of your abdomen. Doming happens when you don't engage your core muscles in a correct way, so the abdominal wall is not able to manage the intra-abdominal pressure of your current position. Other symptoms of diastasis recti in pregnancy may be poor posture, feeling of core weakness, bloating, or constipation. So, is there anything we can do to prevent diastasis recti in pregnancy? The short answer is no. As far as we know, we cannot prevent diastasis recti from developing in pregnancy, but this hasn't actually been tested in research. There are no studies to date that have tested the theory if diastasis recti can be prevented or treated with abdominal exercises or other exercises during pregnancy. However, we know that by protecting the abdominal wall from excessive, uncontrolled intra-abdominal pressure when engaging the core, we are more likely to minimize or at least reduce the severity of diastasis recti. This applies not only when we're exercising, but also when we're performing various tasks of everyday life. That's why it's extremely important to learn how to correctly engage our core during pregnancy and to practice it regularly throughout the entire pregnancy. If we're practicing correct core activation on a regular basis, we're more likely to do it more naturally when performing everyday tasks. This is also important to maintain the mind-muscle connection with the core throughout the whole pregnancy, which will in turn help you re-establish the mind-muscle connection more easily postpartum and help with overall postpartum recovery. The cornerstone of correct core activation is the diaphragmatic breathing. I recommend you watch my videos on diaphragmatic breathing to learn how to perform this breathing technique correctly. You can either go directly to the diaphragmatic breathing movement how-to video or the educational video to learn more about it. But here's a quick recap of diaphragmatic breathing. You can perform the diaphragmatic breathing in almost any position, but I'm going to do it standing now. So you take a deep breath in, and then as you exhale, think about pressing the air out of your lungs with your whole core. That is, begin with engaging the pelvic floor. You feel it comes together and lifts up. And as you continue to exhale, engage your abdominal muscles, both at the front and the transverse abdominals on the sides. So you're creating kind of like a wave of muscle contraction from downward and up. So I'll show you. Now we can keep the core engaged like this while we perform some exercise or task, breathing normally, but keeping the tension in the core. Or we can also re-engage the core like this for every repetition of some exercise we're performing. So as you inhale again, relax all these muscles that you've contracted, releasing all muscle tension and expanding your ribs and belly. Here are some examples of exercises that are good to practice correct core activation and minimize the severity of diastasis recti.
Knee hovers. Stay on your hands and knees, keeping your back straight, and do the diaphragmatic breathing, engaging your core and lift your knees up from the floor just slightly. Hold the tension there for a few seconds and then go down again as you inhale and release all muscle tension. Quadruped core rows. Stay on your hands and knees with your back straight, careful not to drop your back down, and wrap a mini band or a resistance band around your hands. Engage your core with diaphragmatic breathing as you pull the band up towards your torso, and then release all tension as you inhale again and bring the band back down. You can alternate between pulling with your left hand and right hand or finish all reps with one hand first and then the other. Banded sit to kneel pulls. Sit on your knees with your back straight, arms straight out, and with a mini band or resistance band wrapped around your hands. Engage your core with diaphragmatic breathing and stand up on your knees, pulling the band apart just as much as you can depending on the resistance of the band. Then go back down again as you inhale and relax all muscles. Pelvic tilt with diaphragmatic breathing. You can do this kneeling, standing, on your hands and knees, or sitting, whatever makes you the most comfortable. Tilt your pelvis backwards, tucking your tailbone under your body as you exhale during the diaphragmatic breathing. Then reverse the movement as you inhale again, releasing all muscle tension. Resisted diaphragmatic breathing. Place a resistance band around your upper back and hold the ends of the band out in front of your body with your arms bent. Then as you exhale during the diaphragmatic breathing and engage your core, pull the band forward, extending your arms. Then reverse the movement as you inhale again, releasing all muscle tension. Banded marches. Wrap a mini band around your feet. As you exhale during the diaphragmatic breathing and engage your core, raise one knee up as high as you feel comfortable with, depending on the resistance of the band, but preferably so you create about a 90-degree angle in your hip. Then slowly release the tension, bringing the leg back down again as you inhale and relax all muscles in your core.
There are also some exercises and movements that is important to avoid in order to minimize the severity of diastasis recti, such as crunches and planks. These should be switched out with other more pregnancy-friendly exercises, like seated leanbacks or modified, for example doing a box plank instead of a full plank. Back bends are also not good. Avoid bending down like this. We have no core control here, and it's risky for our back as well. We must bend down with our legs, keeping the back straight, and here it comes again, engaging the core correctly. Like this. Some advices and guidelines for pregnant women recommend against heavy lifting, but that's actually not true. It's not necessary to ban heavy lifting for pregnant women altogether. Women just need to know how they can do that safely with correct core engagement. So increasing awareness of diastasis recti is extremely important. This is an underrated topic and it's not communicated enough to pregnant women in general. I, for example, had no knowledge of this during my first pregnancy. I was a first-year medical student and had a good dialogue with my midwife throughout the whole pregnancy, but I had never heard of this until about a year after I gave birth, and at that time I had a persistent diastasis recti gap of about 1.5 centimeters. I had a weak core and an exceptionally bad posture. I'll talk more about diastasis recti after pregnancy in another video, and show you how to check for it and measure it, and teach you much more on diastasis recti healing. Thank you for watching this video, and I hope you learned something new and helpful. Go check out some of my other educational videos or the movement how-tos to learn how to safely perform the various exercises in pregnancy and how you can modify them to your fitness level. Until next time!